This is a video demonstration of a prenatal history and exam, and since it's in the middle of a pandemic, my volunteer is on a cell phone, and I will be verbally walking through the physical steps of the exam, which I've also demonstrated in the full physical exam video earlier. So we are going to first go over the prenatal history as if it were an initial prenatal exam with a brand new client. Do you want your name to be Shailene in this?
Yeah, let's do it.
Okay. Hi Shailene, how are you?
I'm doing good. I'm so glad to finally be here.
Yay, I'm excited. I just want to fill out some of our paperwork real quick, and I may ask some questions that I might already know, but just want to clarify so that we get it written down on paper. So, your partner's name, it's Justin, right?
Yes.
Okay. And then, do you know what day your last normal period was? The first day that period began.
Yeah, I think it was September the 15th. Let me just check my app here.
Okay.
Yep, it was September the 15th.
9/15. And have you looked yourself to see what that would be for your due
Yeah, I
date?
think today I'm supposed to be 12 weeks and 1 day.
Okay. Wow, look at you.
I know, through that first trimester.
Woohoo. So I'm just going to do the math really quick to see. Your periods, are they normally 28-day cycles?
Yeah, 28, 29. Mm-hmm.
Okay,
Yep.
so then we wouldn't have to do anything fancy there. So like the end of June, are you thinking?
Yeah, I think so. According to my app, I'm like the end of June, June 22nd.
That's what I get too. Alrighty.
Awesome.
June 22nd of 21. And then, how old are you?
I'm 41.
And how tall are you?
I'm 5'2".
5'2". And this is is it your fourth pregnancy?
Yes.
Okay. And 3 living children right now, correct?
Yes.
Alright. Do you have any allergies that you know about?
Yeah, penicillin.
Okay. Anything else? Any latex allergies or
No,
any
not that
food?
I know of.
Great.
Sometimes I feel like I have seasonal allergies, but that's the only medication that I'm aware of.
Okay. Alright, that's fine. And then, this should be it would be a little early, but have you felt any fetal movement yet that you know of?
No.
No.
Mm-mm.
Okay.
No, not yet.
That is okay. And then, in your first trimester, we are in the second now, like you said, in your first trimester, did you experience any nausea or anything that seemed like different than your other pregnancies or significant?
No, I didn't throw up any, but I was pretty nauseous throughout the day. It really was more dependent on when I ate. If I ate regularly, then I felt okay. But if I was hungry, I'd get really nauseous. But I haven't felt like that in like a good week or so.
Okay, yeah, that usually is the case when we are a little bit hungrier, our bellies are. That's kind of your body's way of saying we need to eat a little something now.
Right,
Something's
yeah.
not quite right. So I do want to get some blood work done on you. We do a prenatal panel, and then that just gets a few things out of the way and tells us that do you happen to know your blood type from your other pregnancies?
I'm A positive.
A positive, great. So we don't need to worry about anything there. The other things that it would test for are things like immunity to rubella, if you have any sort of like Hep B or HIV is an optional one. Gonorrhea, chlamydia, all of those things, and any other antibodies in your system. Like if you were negative, we could see if you have antibodies to the RHD. But we don't do that here, but I'm going to refer you to a lab to get that work done if you could get that done
Just
before our next visit, ideally, yeah. Just to check and see how we're doing there. Otherwise, I want to look over and see, let's get some history done from you. The first few questions are just general medical history. And then you're just going to tell me if you have any sort of significant history in the areas that I'm going over. And if not, just we'll skip it. So, head, ears, nose, throat, eyes, anything.
I wear glasses.
You wear glasses,
But
okay.
other than that, I don't have any other issues to speak of.
Alright. And cardiovascular, any heart issue or vascular related things? Great. And respiratory, have you also, along with this, had TB ever?
No, I've never had TB,
Okay.
and I don't have asthma or anything, so I've never had
Perfect.
any issues with that.
Any issues with your GI tract?
No, I mean, sometimes I can be a little constipated, but
Okay.
no,
No, like
issues with it.
Crohn's or ulcerative colitis? Nothing? Okay.
Nope.
Alrighty. Any sort of metabolic issues? Anything wrong with your endocrine system? Any hormonal things? Okay.
Nope.
All those are good. And then any neurological problems? You had any? This would be like brain.
Like seizures or
Yeah, brain related. So brain and spine, nerves also
No.
involved. Okay. Do you have any significant psychological or emotional issues that I might need to be aware of?
No.
Okay. As far as you know, are you negative for any hepatitis, ABC?
Yeah, I'm negative.
Okay.
I don't think I have any of those.
Anything musculoskeletal that is abnormal?
No.
No.
I mean, I see a chiropractor just for wellness, but I don't have any
Sure.
conditions.
No sort of scoliosis or any sort of
Uh-uh.
muscular dystrophy things?
Nope.
Okay. Any skin disorders that are significant? Psoriasis, eczema? No. Okay. History of any operations that you've had done? Like major surgeries?
I had no operations.
You are just a healthy lady,
I had
aren't
my
you?
wisdom teeth out.
Okay. Yep.
And that was, I did go under anesthesia for that, and I had no issues. And then I had a lip surgery to take like a cyst out of my lip, also had anesthesia for that, and everything was fine. But no,
Great. No adverse reactions to anesthesia. Was it just a general
Came right out.
or a local? Was it a local?
I was under for that.
Oh, okay. So great.
Yeah.
Any blood transfusions that you've had?
Nope.
Nothing. Okay. And then we already went over your allergies. All right. Next, I want to go over your gynecologic history.
Okay.
Would you say your menstrual cycle is regular or irregular?
Regular.
Okay. And we said every 28 days and goes 6 to 7 days? Is that how long?
More like around 5.
5 days. Okay. How old were you when you got your first period?
I was 11.
And do you experience major cramping or pain or discomfort?
No, just normal. I would
Normal.
Like this.
Okay. Just
Usually
the
on my first and second day.
just the expectant, but nothing
Yeah.
like abnormal. You have to take off the whole week because you're in severe
No.
pain. Okay, great.
No.
Have you had any abnormal pap smears ever? has anyone ever told you have any cervical issues or cervical disorders?
Nope.
Nothing. Have you ever been diagnosed with pelvic inflammatory disease?
I have not, no.
Have you ever had gonorrhea or chlamydia?
Nope.
Herpes?
Nope.
This one says for yourself or your partner for this one.
So my husband has the cold sore one, HSV1.
Okay. But not genital herpes.
But I've never actually had a cold sore.
Okay.
So I've been told before that I probably am a carrier of it, just dormant, because he has it and I'm a kiss him. So, but I've never had a cold sore before. So.
Okay. All right.
Is that something that you'll test for in my prenatal panel? Because I've never been told with my other pregnancies that I had it. So is that a part of the testing?
I don't think so.
Okay.
Oh, yes, it is. It is.
Oh, okay. So
And they'll tell you type 1 or type 2 for this one.
Okay.
Mm-hmm.
Good.
Yeah. Just good question.
Yeah.
And then have you ever been diagnosed with syphilis or genital warts or any other STDs?
Nope.
Nothing. Great. Have you ever struggled with infertility at all? No.
Nope. My husband can look at me and I get pregnant.
I was gonna say we're on baby 4, so I wouldn't think so. Have you ever found any breast lumps when either going to a provider to do a breast exam or you yourself doing one?
No, I have not.
Okay.
And I'm not the best at doing self-exams. I try, but I don't do it super regularly.
Honestly, the partner is more likely to notice a difference than you yourself, and that's okay. And so if your husband finds something and brings it up, I never knew I had like a little weird lump on one of my boobs until my partner told me about it and had me go get it checked. So
I'll have to ask Justin.
partners are great watchers of changes.
Right.
For any of your previous babies, did you test positive for GBS? Do you remember?
No, I was negative.
Awesome. Have you been diagnosed with any fibroids or an ovarian mass ever?
No.
Okay. And then we already went over your surgery, so you've never had a uterine surgery?
Nope.
Okay. And were you on any contraception when you conceived?
No. All of my pregnancies were planned, so
Okay.
I stopped any form of contraception and attempt to try to get pregnant.
Great. And what are prior contraceptions that you have used otherwise?
I've used birth control pill, and I've had a Mirena IUD and a copper IUD.
Okay. Great. Is there one that you preferred over any?
Probably the Mirena, just because I had the least amount of like side effects with it. But
Okay.
I know after this baby, we're planning on my husband getting a vasectomy.
Okay. Good to know. And then, all right, so you are a G4P3, no miscarriages, and no therapeutic abortions.
Nope.
And 3 living children. Great. Okay. Baby number 1. Can you tell me? We're gonna go over the history of each baby.
Sure.
Can you tell me her birthday?
Yep, April 29th, 2003. And I was 40 and 5, and that was an induction.
You know your stuff.
Yeah. And she weighed 8 pounds, 2 ounces. I don't know if you want that.
Yeah, I do. 8'2".
And my second was, I was 39 and 5. I had a membrane sweep, probably the day before. And I went into labor the following day. Her birthday is August 18th, 2006. And she weighed
Did you get an episiotomy with either of those?
My first.
With your
An
first one?
epidural and an episiotomy was my first. I did tear with my second. I think it was a second degree. It was perineal and periurethral, so I had stitches down and up, but I healed really well.
This is what you get when you interview a midwife about her history. For both of those, can you tell me how many hours you were in labor?
Both of those labors were 12 hours.
Oh, okay. And the last baby.
My last one, I was 41 weeks. It was a planned home birth. It was a 4-hour labor, and he was 8'8". And that was a spontaneous labor.
And what date was he born?
He was March 13th of 2015.
Okay, great. And then just a quick family history. Does anyone in your family have hypertension or high blood pressure?
No.
Does anyone in your family have diabetes?
My husband's dad did, but he has passed away.
Okay, was it type 1 or 2?
1.
And then anybody on your side of the family?
Not on my side, no.
Okay. And you have twins in your family at all?
Nope.
No twins. Do you have any other congenital anomalies in your family?
Not that I'm aware of.
Okay. And any other family history that you think might be significant that you want in your charts?
My paternal grandmother had cancer, breast cancer, and it ended up going throughout her whole body, and she passed away with multiple cancers. My dad had a heart attack, and that was probably in 2002. He had like high cholesterol or something, and he ended up having heart surgery, like stents put in.
Mm-hmm.
And then he's been in fine health since then and no repeat issues.
Okay.
But that's it I can think of.
Sounds great. And then are you taking a prenatal vitamin right now?
I am. I'm taking the Garden of Life.
Garden of Life, great.
The whole horse one. Taking those.
Are you taking an additional iron supplement?
No, not right now.
Okay. I think the Garden of Life one gives you enough iron anyways, but
Yeah, I'll have to look. And I remember from my other pregnancies, I normally start out really good in iron, and I've never had an issue with anemia, but that's something that'll be checked in the prenatal panel, right?
yes.
You'll kind of see where I start.
That blood work will definitely tell us all how your hemoglobin hematocrit is and everything. Do you take any other supplements, herbal or over-the-counter drugs or prescriptions?
Well, with it being COVID, I do take a vitamin D. I think it's, without looking at the bottle, I think it's like 5,000 I use. And I don't take it every day. I probably take it like 3 times a week. But I spend a good bit of time outside as well. So, but will you be testing my vitamin D to see if I do need
Yeah,
supplement?
I like to incorporate that in the prenatal panel too, especially because we live in North America and many people have a vitamin D deficiency, and that's actually something I want to supplement if we need to. So,
Perfect. And sometimes I take vitamin C.
okay.
Especially if I'm feeling a little, like if I feel cold coming on or something, I'll take vitamin C, and then sometimes I take zinc. Usually during flu season, I'll try to make sure I'm regularly taking those 3.
Okay. That sounds great. We did have nausea, but no. For this pregnancy, have you had a fever or infection at all
Nope.
so far? Great. And then do you use tobacco, any other kind of drugs, or drink alcohol?
No, I do not.
Okay. And
I
then
have never smoked.
do you drink any caffeine?
Yeah, I do sometimes. I shouldn't, but I do like my Coke every once in a while.
Okay. That's alright. Sometimes you gotta have a little Coke. Sounds good. So next, this one I will leave up to you, but we can do an optional pelvic exam for
Okay.
that. For just the beginning, I don't normally do them throughout care, but just to get a baseline of things, I'll offer it, but that is 100% optional for you.
What would be the benefit? Like, what are you looking for?
Well, it just shows me the baseline of where everything is. I can see where your cervix is, if there's anything unusual that I might want to make note of or want to get looked at in case something stands out that maybe would risk us out of care or something, but I don't expect to see any of that. A lot of it is see where your cervix normally lies, and that can tell me if we have some abnormal changes. Seeing the size of your pelvis. I know we've had 3 babies and we've had 1 successful home birth, so I'm not so concerned about that. And because you've never had any of the other like pelvic inflammatory disease or any sort of STDs or cervical issues, I'm not too concerned with it. And so
I think I'll pass. I don't
Okay.
think I want to do that.
That sounds fine for me. Then I will just take your vitals, and we'll do just a normal physical exam, and then we should be good. And then we can talk about other things if you have any questions afterwards, okay?
Do we get to listen to the baby today?
Well, we can try. It's 12 weeks, so I can try with a Doppler, but it will be pretty tough. Next, if you want, I can give it a go. Next visit, we would definitely hear it though. So
Okay.
I'll leave that up to you.
I'd like you to try.
Okay. Some parents, if I can't find it today, might get a little more anxious, but and I wouldn't necessarily want to do it if I think it's going to make it worse, but I think you would be fine if we wanted to try, and you understand that we may or may not find it today, and that doesn't
Yeah,
mean anything.
I totally get that. But I just would like to hear it if we can.
Sure. That little fish might be swimming under your pubic bone though, so sometimes that's hard. Okay. So I finished my history taking. I would do a blood pressure, temperature, and check her pulse and write down all those responses. I would have her lay on her back and palpate for fundal height. She is 12 weeks and 2 days, so it would be maybe just a hair above the pubic bone, since 8 weeks would be at the pubic bone, so in between the belly button and the pubic bone, but not up very high yet. I maybe 4 finger breadths above or below the umbilicus, which is nothing to measure yet. And if I did happen to find heart tones, I would expect them to be on the higher side, 150s, 160s for such a little baby. Then after that, I would have her get up, check in with her, see if she has any questions about anything, and if there's anything she would need before our next visit, and then I would refer her for the prenatal panel and schedule her next visit in 4 weeks.